batuwuliriza mwebali kutujoininga olwaleero tuli wano mu studio yaffe nga bulijjo nga tubatuusako program yaffe manyiddwa nga Tuwaye. Mwanjuzi omutesitesi amanyi nga bulijjo John Mutyaba ate nga nina wano Dr. Musherure, Paul Musherure. Agenda kubanga atuliisa ekigambo tuyigiriza engeri ki gye tuyinza okukuumamu obulamu obw'amannyo gaffe era nga mukulu mutendeke bulungi banga abadde liweze nga ali mu profession ey'okujjanjaba amannyo. Dr. Musherure, we are so happy to have you here today.
Yes.
Thank you very much for coming and honoring our invitation. We will start off by just acknowledging what's going on in our community. We know that we just recently lost a friend, Dr. Samuel Kiprotek. May his soul rest in peace. And we also lost Wanjiru, who's my wife's roommate in college. And we also wish her all the best in her, in her final resting place. Dr. Musherure, you are a member of our community, the Ugamin community, and you've lived here for some time, and you have done quite a lot for our community, and we thank you for all those things. But we also thank you so much for accepting to be here and talking to us, teaching us. And the reason that we are speaking, this program today will be in English so that all those, our kids and everybody can understand at least the content of what he's going to talk about. Dr. Musherure, please introduce yourself to our viewers and and tell us a little bit about yourself so that we can know you better before you dive into your real stuff.
Yes, I'm fortunate to be able to be here today. My name is Paul Musherure, and I am from Uganda. I come from a place called Nyakakoni. It's in Ruti in near Mbarara, and I was raised in Kampala. My parents worked for the East African community, so I grew up in Kampala. I came, I studied dental, started long ago, and I studied to be a dental assistant in paramedical in Mulago many years ago. And then I got an opportunity to come to the States, and I started pursuing more dentistry. So I found out the system was different, but I went through the loops and I got a dental degree, after which I specialized in pediatric dentistry. And upon specialization, when I completed, that's when I made my move from Michigan to Minnesota. And soon after that, I got married to my sweetheart, who Shatsi Musherure, who is a lawyer by profession. And we have 4 children. We're blessed with 4 children who are now almost all young adults. But that's what I did. I came here to work for a company called Health Partners. And I've been with them for over 25 years, almost 26 years, doing the practice of children's dentistry. And I can say certainly that it has been a good stint, because now after 25 years, you always have to start figuring out how to end your career. So it has been a good period of work with children. That's about it. That's about it.
Thank you, Dr. Musherure.
Mm-hmm.
And our program, of course, will continue here. We have more questions coming, and we want to ask you to help us. What is a typical day like in your work environment?
So, being a pediatric dentist, I I see children for checkups and also for fixing their teeth if they have cavities. So that would be a typical day. I could see up to about maybe 13, 14 children for fixing and up to like about 20 something for checkups. So it's a busy day, a full day. On a couple mornings every week, I begin also by going to the operating room. So I go to a hospital setting to see children who are unable to be seen in the clinic, either with special needs or with who are too little and they have a lot of work. So I have a mixed practice where I do some hospital dentistry and also some regular clinic dentistry. So that's my day. It's a busy day. Usually I chose the option of doing 10-hour days. So I do 4 10-hour days. I've actually cut back 1/2 day because of getting older, I would say. But otherwise, it's a very packed day when I do a clinic day, 10 hours. And that's my typical day. I see a lot of kids with dental problems. And I chose to work in this situation where I'm working mostly in the inner city with the underprivileged children. So they tend to have a lot of dental problems because what we call dental IQ of the parents is not high enough. So they don't seek care or they don't have those habits set in early with the children. So they end up with a lot of cavities early. And we saw a spike in COVID when the kids were staying home all the time because they were snacking all day. And so we have a lot of children with a lot of dental problems with holes in their teeth. And so they need help. Those who come regularly for checkups, normally those don't have so many problems. But because I'm a pediatric dentist, most of the general dentists refer the children with a lot of cavities to us pediatric dentists. So part of my practice is also driven by a referral base where children who have many needs are sent to us because they are not able to control them in a regular clinic.
All right, Dr. Musherure. We will continue here with our program. Of course, we have so many questions for you. Could you please outline some of the fundamentals of good oral hygiene?
Yes. So basically, we always say that the mouth is a window to the body. Someone who has problems in their mouth most likely will have also other systemic problems in their body. But the idea of oral health, coming back to cavities first and the teeth, is that to make a cavity, you need 3 things. You need the tooth, you need bacteria, which by the way, we get it from our parents, because when you're born sterile. You don't have those bacteria that create cavities. And then you need the plaque, which is the food that stays on your teeth and you're not brushing it off. If you remove one of these things, you don't have cavities. You can have a mouth full of plaque, but if you don't have any bacteria, you're fine.
Oh, wow.
That's very rare. You can you have no teeth like a baby, then you're fine. Or an elderly person, you're also fine. So basically, the idea of good oral hygiene is how to control these 3 factors. So if you can, there's one thing you can really control is the plaque. If you remove the plaque, you reduce the number of bacteria. If you reduce the number of bacteria, then your tooth doesn't break down. So that's for the dental cavity side. The other part of oral hygiene is the gums, that support your tooth. So these gums are supposed to support your teeth. Underneath is some softer bone, and your tooth sits in that bone. If you don't brush your teeth, then the plaque increases, and if some of you have realized that it can become hard, like what they call tartar or calculus. And now you're removing your gum away from your tooth because you are not cleaning. So as the gum is removed, the tooth gets loose. And so you find a very healthy tooth falling out of the mouth without a problem.
Wow.
Because you didn't look after the gums. So it's a two factor thing. You have to look after your teeth, but in the process, you're also looking after your gums for a healthy mouth. So that's basically what we look for in good oral hygiene.
Wow. That's very, very good to know.
Mm-hmm.
Some of the things there that I haven't heard about, but yeah, that's good. Good information for us. How often should people really visit a dentist for checkup and for cleaning?
Basically, we break down our patients into categories. There's the patient who's high risk for cavities, moderate risk, and low risk. The patient who is high risk for cavities is someone who sometimes we want them to come maybe every 3 to 4 months. Even if they're high risk for gum disease, it's the same situation. The one who's moderate would be someone who has maybe 1 or 2 cavities, and so that one can come every 6 months, sometimes up to a year. The one who is absolutely low risk, does not have a problem with their gums, does not have a problem with their teeth, we recommend at least once a year. And some of them can even make it to 1.5 years. But generally, what you're looking at is basing it on risk. How at risk are you to get dental decay? So for children, that's my area, we normally do every 6 months for familiarization, because a child at the beginning wants to know not to be scared of the dentist, coming in regularly. So every 6 months is more the tradition. And then eventually, as they get a bit older and they stay low risk, then they can also go to once a year. But generally, it's customized according to the risk pattern.
More questions here. I'm sure you're ready for this. What are some of the common mistakes people make in their daily brushing and flossing?
I think the biggest thing we have, like even in our cultures, is that people tell you, brush your teeth in the morning before you go to work. And that is okay. But the true focus has to be the one when you brush your teeth before you go to bed. Because basically, when you close your mouth, the temperature is going to be warm in your mouth. The bacteria that cause cavities thrive in this kind of a condition. So if you had a snack before you went to bed, a cup of tea, a little cookie, maybe you drank some milk, like in cases of children, they want milk right before they go to bed. It sits on their teeth. And then they go to sleep, so the mouth is now closed. The food, they're not generating enough saliva, because when you cry, when you talk, you generate a lot of saliva, which in the process of generating saliva, it also helps dilute a little bit. But here you are sleeping. At most, if you're a child, you're drooling. So basically, it's only the bottom teeth that have some saliva. The rest of the teeth, whatever you put in last, sticks on your teeth. If you don't brush it off, that's what breaks down to get cavities. So of the 2 brushings, morning and night, the most important is the night one. And once the teeth are brushed, if the child says, I'm thirsty, they should drink water. If they drink something else, you make them brush again, so that they are aware that to go to bed, you have to have clean teeth. The idea of flossing is also important, because when you brush your teeth, yes, you use toothpaste, and the toothpaste has a little bit of fluoride in it, which helps strengthen the teeth. But if you don't floss and you happen to genetically have very tight teeth, now you have a problem, because food and juice and milk, people think it's only sweets, but it's everything goes in between your teeth and you don't take it out. Next thing you know, you go in for a dental checkup and they take those x-rays and they find cavities between your teeth. So flossing is also very important. But if I was to advise you, I probably wouldn't floss twice a day. I would floss before going to bed, brush really well before going to bed. In the morning, everybody's in a hurry, going to school, doing what? You just do a quick brush so that the children at school don't say you have bad breath. But the most important one is the one before you go to bed.
That's very good information. A lot of people mistakenly think that brushing your teeth in the morning is actually more important. And that's why you find, I guess, many people brush their teeth in the morning, but they forget to do that at night.
That's correct.
To understand that it's actually much wiser to do it at night than in the morning. Of course, you can do both, but it's better that at least before you go to bed.
That's right.
Yeah. Thank you, Dr. Musherure. I see I have some other questions here. Some of those you answered while you responding to that. You responded to the kids' question.
I can add a little to the kids.
Okay.
So in terms of managing children's teeth, we don't expect a child to be efficient with brushing their teeth until almost age 8. So there's a habit within our families where you tell a 4-year-old, go and brush your teeth. And yet the child he will just go in there, play with the brush up and down and be done in 1 second. And by the way, this continues into teenagerhood. You can tell your son or whatever to go brush their teeth and they're done in just a couple minutes. So the focus is supervision. When they're young, first of all, the amount of toothpaste should be very little. So when a child is 6 months old to a year, you should actually have, if you don't have a thumbnail, you actually get a baby toothbrush. Part of it is training the child, because the child will probably have only 2 teeth in the bottom, but you're just putting a smear of toothpaste, very little, and then you just rub it on there. Otherwise, as they get older and have more teeth, you're brushing and you're playing. You let them do their part, because all of them say, I know how to do this. I can do myself. This is a standard children thing. So you're saying, okay, let you go ahead and do it, but mom has to have a turn, or dad has to have a turn. And so you go in there after them. You don't have to put more toothpaste on. You can actually just get water on the toothbrush and then just do circles and just do a complete cleaning of the teeth. So the child gets familiar with having their teeth thoroughly brushed. Now, this helping business, when the child is 4 or 5, it's the night brushing, which is emphasized again, that a parent should be helping. When they turn around 6 years old, you can do the weekend 2-3 times a week, making sure they're getting better. And then by 8, that's when we say maybe you just let them go. But the thing about letting them go is that you should still surprise them. You know, you just, let me see your teeth. Have you been brushing this week? And you just check and see, because the kids might be very lazy about brushing their teeth. If, however, you've trained them right, so there's the different phases that the children go through with brushing. So that's just a little emphasis on oral hygiene. Yeah.
All right. Thank you, Dr. Musherure. We still have a few more questions now. We're going to talk about preventive measures and what role does diet play in maintaining strong teeth and healthy gums. Yep.
So those are two different questions. The thing about teeth and diet, like I explained before, anything sticky is not good. So anything sticky that can stick on the teeth is not good for the teeth. So people who have, basically, people who are eating sugar cane, you'd think that the name is sugar cane, so you think, sugar, that's going to be bad for the teeth. But the sugar cane is actually good for your teeth, because it is rough, and when you chew it, it actually cleanses your teeth. So you find people who have sugar cane, because of the roughness of the fibrousness of the material, it cleanses your teeth as you eat it. So that is a healthy kind of food. The foods that are not sticky. So basically, having our regular food, what we eat daily, is pretty much okay. But if you are going into having very sticky candies, that's the thing about candy, is if it's the sticky type. You know, if you have an M&M, which is a small chocolate, it can actually dissolve all the way. But if you have a Laffy Taffy or a Now and Later, those really sticky ones, they stay in your teeth and they stay for a long time. So the issue is trying to avoid sticky foods. And then also the biggest deal about diet and teeth is being on schedule, especially with children. If you're the kind of person who sits at your computer and has a cup of coffee with sugar in it, and you just sip all day, you're going to have a whole lot of cavities. But if you're a construction worker and they give you a lunch hour and you drink the worst pop, Mountain Dew, and you finish the whole 2 liters, in a few minutes, you will not even have one cavity. So the concept is frequency. Kids who are picky eaters, talia. So you're there sitting with them at lunch and they're trying to finish your dinner. It takes an hour. The kid does not want to eat. Those ones have to be brushed thoroughly before they go to bed because they are more likely to get cavities than this big kid who comes in and eats all his food and then goes and plays. So the frequency for adults, if you're going to sip on something, sip on water, not sugared coffee or soda. That is dangerous for your teeth. If you're going to slam it all at once and drink it in 2 minutes, that's fine. But most people like to sip along a little bit, and then you have snacks that are sweet and sticky. So someone who's eating nuts is better than someone who's having Skittles. Some people know what Skittles are, but those ones are very, very sticky, but you keep, you just throw one at a time. I was seeing this, what's his name, Snoop Dogg on The Voice. He had a bag of Skittles every time. Every time he sat down, that's what he would be snacking on. So I just wonder who his dentist is. But my issue though is the stickiness and the frequency.
Okay. How about starch? I know that, in Uganda or where we come from, there's a lot of food we eat, potatoes and bananas, cassava, millet, all those starchy foods there. Are they good for us?
Yes. I mean, in general, you'll find that someone, not a Kampala person, because Kampala people are bad, but they're just as good as being in the Twin Cities. But if you're in the village, you'll find someone who has his original set of teeth with no problem at all.
Oh, really?
The only issue is that if you're into the millet stuff, you can wear your teeth down. So you find that their teeth generally are very flat on the top because they have a hard diet, so they wear their teeth down. But in terms of issues, they have issues with gum sometimes, but not with their teeth. So you find their teeth are solid, they don't have a cavity in their head. Now, if they are brushing, their gums are also going to be fine. But if they're not, you find that when he smiles, it looks dirty. But if you go in to check, you will not find a cavity. But what happened is when we got introduced to sugar and having sugar with your tea, that's what destroyed the diet in the villages also. Because now people like to have their tea with or more like their sugar with their tea because they put a lot of sugar. But basically, you find much in our traditional diets are very dentally positive than negative because they don't create more cavities. But now with an introduction of Western foods, we have a problem with that.
I see. How about bread? I think bread. I was thinking bread is. I know in Uganda we didn't eat as much bread as we eat here, but I was thinking that is it also sticky? Does it matter if you eat a lot of bread or as long as you floss and do your nightly thing?
It all comes down to oral hygiene, but yes, some breads can be very sticky. So
bread and cookies.
Yeah, that's the whole issue. So that's the thing about the stickiness, because cookies can have. It's not just a straight cookie. There's like raisins. Raisins can be very sticky. So you have a chocolate chip and raisin cookie or something like that. So anything sticky is the problem. And so the issue is the breads. Some people have grainy bread, which is probably a little better than a processed white bread for the oral hygiene, because the processed white bread could stick in spots if you have areas in your mouth where food sticks. So I would generally focus on the oral hygiene part at the end of the day. but a lot of the sticky foods are detrimental. Mostly having the frequency, in other words, having it constantly all through the day.
Mm-hmm.
So if you had tea with no sugar, then you can drink to your heart's delight, because that's not going to cause a cavity. While if you have tea with sugar, then and you sip it instead of finishing it at once, you're going to have more issues. So,
I see. Mm-hmm. All right, Father, we wanted to ask you about how smoking can affect, your oral health.
Yeah, so I talked a bit earlier about how when children sleep, sometimes they drool. So the benefits of saliva in our mouth, we cannot even say. The person, when you do a checkup and you find a patient who does not have a lot of saliva in their mouth, then he's prone to have a lot of other issues. Mm-hmm. So the thing about saliva is that it neutralizes, it helps clean your mouth, it keeps your tissues less sticky. So for instance, children or adults who cannot close their lips because their mouth is constantly open, and the teeth are showing. So those teeth are going to be very dry. So next time he has something sweet, that sweet thing will stick because it's sticking on the dry surface of those teeth.
Okay.
While someone who has saliva, it's always moving in their mouth, so the teeth are generally moist, the gums are moist. Mm-hmm. So when it comes to smoking, one of the side effects of smoking is it affects the salivary glands. So once you are a chronic smoker, your glands will be affected and will not produce saliva. So all of a sudden, you have a very dry mouth. So all of a sudden you go in, I brush every day. I look after myself. And then you're the one with cavities. I'm like, why does he have cavities? Well, because he doesn't have enough saliva, which helps us in diluting. So that means there's a higher risk. Then smoking also has much worse issues. So for instance, we talk about cancer of the mouth. One of the checkups, when you go for a dental checkup, you see the dentist say, take your tongue out, or maybe he will use some gauze and pull your tongue to look at. Because the base of the tongue, where the tongue is attached to the mouth, that very corner there is where someone who chews tobacco, smokes a lot, that's where the cells begin to change and you get what they call squamous cell carcinoma, which is one of the more common cancers. And it's very dangerous, spreads very quickly, and that's what kills people or maims them. So they end up having to lose maybe their jaw and some of the tissue around that area of the tongue, sometimes part of the tongue, just to stay alive. Mm-hmm. But so smoking has many detrimental effects. Much worse than a sugary drink, but it's for sure something that affects oral health. Just to touch on that also, is we do have teenagers who are now into, they are aware sexually, so they end up having things like oral sex, which in its sense there's a virus called HPV. And that HPV virus is, once it's present and it comes in through something like oral sex, it also triggers a carcinoma of the mouth, a cancer of the mouth. So you find oral cancers that are coming from HPV that was introduced because of oral sex habits. So that's another thing about the mouth and health.
All right. Thank you, Dr. Musherure. And then how about just chewing tobacco? Is that similar?
It's even worse. People who chew tobacco, they usually have a pocket where they put it, like in the cheek, and it just stays right there. Inevitably, that's what I was talking about, the back part, because they usually put it in the back part and they have a little pocket where they put it and they keep spitting. That, and it has become even more popular amongst young people again, because they're doing all these chewing tobaccos with different flavors, and kids like it. Well, that's where the oral cancer starts. And their mouths are extremely dry because they affect their salivary glands. Okay. So they have gum disease and cavities because of that.
That's very good to know. So, guys, don't chew tobacco. If you're smoking, try to cut it. I know it's not very easy. I know you would have to gradually get off of it because of the advice that we have got here from Dr. Musherure. Further, are there any specific products like electric toothbrushes or certain mouthwashes that you recommend?
Mostly any toothpaste. Basically, there are some ethnic groups where they don't have toothpaste, but they use charcoal, and there are some who have the little sticks that they chew the end of and it becomes soft, and they just use that. So really, cleaning your teeth can be done with anything. So what we know as normal toothpaste, Crest or Colgate, is actually fine rock. So they crush it. So it's a very fine particulated rock, and they put a little additives to it and fluoride and everything else. So any fluoridated toothpaste is good for you. The thing that might not be good is the amounts. So for a little child, you just do a little smear. That's an infant. And then as they get older, you do like a size of a rice grain. Then you go bigger, like 4-year-old, and so you do the size of a pea. But don't put too much. Now, if you leave the child with the tube and the toothpaste tastes good, they're going to put a lot. And that is too much fluoride. As an adult, you can put the length of your toothbrush if you want, but you don't really need. You can just do half the toothbrush length. And that's the way to do it in terms of amount. But that pumice or that crushed rock helps take off the cavities like charcoal would do. So that's what you do, is just removing the plaque, actually. It's not the cavities, but the plaque on your teeth. So that would mean that most of our toothpastes in the market are okay with fluoride. Now, there's the anti-fluoride movement, which has come up, and now we have a Secretary of the Treasury of Health who is coming in with that. So you will find some parents will use Tom's toothpaste, which has no fluoride in it, or they look for holistic toothpaste. Well, I've been around for a quick second. So I have seen the children whose parents don't use the fluoride, and they're the ones I'm fixing their teeth. It is almost automatic because it's harder. The actual fluoride ion has helped strengthen the outside of your tooth, the enamel. So if you don't have any fluoride at all, you better be a super cleanser, because your tooth is more prone to get a cavity. So there's a lot of movements around, so you'll find toothpaste that says no fluoride. Now, for an infant, you could use, it's got like a teddy bear on it. It's called Oral Gel. Or I mean, it's baby training toothpaste. So it's training toothpaste. So that one does not have any fluoride in it, and that's okay. You can use that in the first tooth, 6 to 1 year, and that's okay without the fluoride. But those are the things. The other thing is the mouthwash. We have the mouthwash that's focused mostly on the gum, like Listerine, and then we have the mouthwash that's focused on fluoride. So with children, you're not too worried about gum disease. So generally, you would do ACT for kids, something like that. So ACT is the mouthwash. It's there for adults, it's there for children. Listerine also has Smart Rinse, which has fluoride in it. So you can do that as long as the child can swish and spit. If the child is too young and wants to drink it, the one way you do it, if you think that they're at a higher risk for cavities, is you brush their teeth regularly first, rinse the toothbrush, dip it into the ACT, a little bit of ACT, or the mouth rinse, brush it on, go to bed. So now you haven't given the child too much to swallow. It's just enough to go on the teeth, and they can go to bed. So those are some ways in which you do it. Electric toothbrushes are a fun tool. They actually do a better job, because if the child knows how to use the electric toothbrush, and because of the bells and whistles, the ones that make a sound after 2 minutes, you can actually find children spending longer brushing, which is a good thing. When they're younger, you can let them do the electric toothbrush, and then you come in later after them with a regular toothbrush just to clear up the edges, to make sure that they did a good job. But that's my opinion on children. But electric toothbrushes for adults work perfectly. I mean, some people use Sonicare, Oral-B, but from the feedback, it seems that people really love those who love it really love it because they do a thorough job of cleaning your teeth. So I would recommend an electric toothbrush if you are headed that way.
Okay. And in terms of Colgate, Crest, and all of that, I know I like Crest. I use Pro Health. And I thought it was working for me, but I wanted to get some expert
I have no
views on it.
They all work. It's really true. I mean, they all have the same basic thing. So it's up to you whether you go with Crest or Colgate. You know, the one that is got a little bit of medicinal effect is Sensodyne. So for people with sensitive teeth, it does actually help with the sensations of your teeth. But otherwise, if it's just regular brushing, like I said, some people use charcoal. You can do what you want, as long as you're doing an effective job of removing one of those, the plaque from your teeth. You should be fine.
I see. Could you talk about the latest advancements in dentistry and how they benefit patients?
So the thing that has advanced in dentistry, I would say, first of all, is the materials. So the materials that are being used for fillings, crowns, everything seems to have gone up a notch. Like it's more durable, it looks better, it has all these things, even the ones for, people who want to bleach their teeth a little bit so they are not so brown, and everything has advanced in its different ways. The systems of application have not changed, but the actual materials themselves have changed. So we are seeing a whole lot more advanced treatment. Another thing that has changed is what we call prosthodontics. So that is the dealing with, missing teeth. You get dentures or that kind of stuff. We have now, we have what we call the baby boomers are living much longer. They actually are keeping their teeth. And so you're finding a lot of elderly people with their teeth. And then they lose one tooth. Now, the traditional way of replacing one tooth would be to cut the two teeth next to that space and put crowns and then stick them together with a fake tooth. So someone, when he smiles, you see a tooth, but it's actually a bridge. It's in between the two teeth that have crowns. The advancement that we have now is that we call it implants. So implants are doing a much better job. So scientists came up with a material that is really can adhere to the body, and that's titanium. So what happens
to the tooth,
to the bone? So what you do is you have one tooth missing and you want it replaced. Instead of cutting some crowns on a teeth that don't even have a problem to try and get a bridge, in that very area where you're missing a tooth, if you need more bone, they can put a little more bone. And then they put a titanium screw. This screw is inserted in that area, and they let you heal for maybe 6 months. And then you come back and they do an x-ray to see if the screw caught, like that the bone grew into it and now the screw is solid. Once that screw is solid, then you just go for an impression and you get a tooth that is now just popped on to that screw. And you have a tooth that is actually more solid. Now, you can't do this in children or teenagers because their bone is still growing. There's so many changes.
Yeah.
But in adulthood, it's a perfect way to replace a single tooth or two teeth. And in fact, now with the more elderly, if they have to lose all their teeth in the top, for instance, you would make a plate, which is called a denture, with the teeth in there. Now, those dentures, as you get older, they get loose. So you find an old person having a problem maintaining that denture. He has to go get a realignment or a new denture. Now, they get 4 implants, those 4 screws. They have one in each corner, and then it has a button at the end of it, and it snaps onto the denture. So the denture is not holding on to gum to get loose.
Right on the bone.
It's right on the bone. So then you walk around with your denture for a long time without having that problem of.
Wow.
So those are the advancements we see in prosthodontics. In terms of orthodontics, which is braces, the advancements are many. So for instance, a teenager will go in for braces and you do an impression. It used to be that you would mix up a paste to make a mold of their teeth. Now it's digital. It's just the camera just goes around your mouth and you get an impression, which is then translated into a computer, and there you go. You've got your perfect impression in detail. Then the children who are not, there are certain kids whose braces are not too complex. They can use Invisalign, which is advertised. Because Invisalign is just an impression. It's like a plastic model where they put it to where they want the teeth to be. So you put it on, it's tight, it moves your teeth just a little bit, you go in after 3 weeks, they make a new one to the next level. So you just get different plates. And if you follow those plates all the way through, you haven't got dentures you haven't got braces on your teeth, especially for teenage boys who don't like brushing their braces. Now they can take it off, brush their teeth, put it back on. So after a series, you have your teeth in line without having worn braces, except that you're using Invisalign. So that's very popular with kids today.
Yes.
I think it might be a bit more expensive, but it's doing the same job. So those are advancements in orthodontics, in prosthodontics, and even in the materials that we use for fillings.
That is pretty awesome in terms of technological advancements. Of course, what's the biggest difference between orthodontics and dentistry? Is there?
That's right. So normally when we all go to dental school. So we all go to dental school, you do your 4 years of dental school, and then after dental school, a dentist in America can go straight into practice. Most of them do maybe a year of an internship, like an internship before they start practice. However, from that point, now you can go into specialty. So I was at the University of Michigan. I did my 4 years of dental school, and then I went into pediatric dentistry. And I did a master's plus my residency, so I ended up 2.5 years of specialized training in children. And that's why I have the ability I have privileges to go to the hospital, because I got trained extra to be able to do certain things for children. And even we did a lot of psychology, behavior management, things like that, which were above and beyond general dentistry training.
Okay.
There's orthodontics, which is the ones who do braces. They also go in, they stay usually 2 years after dental school. There's prosthodontics, which also stay about 2-3 years after dental school. They're the ones who do specialized dentures. They deal with reconstruction of the mouth. So someone can have a motor accident, or they are born with certain kinds of teeth that are not working right. So different systemic conditions. The prosthodontist will redo the whole mouth. That's someone who's in that area. A periodontist is the one who does the gum disease. So they do the surgeries of the mouth, of the gums, to try to bring them back up. Sometimes you have gum which is because of, like I said, because of not caring so well, the gum recedes or goes away from the tooth. So to restore that, they will actually cut some gum maybe from your palate and reimplant it right in that area to give you healthier gum for that one spot. So there are different ways of doing. Those are the gum diseases. So the orthodontist, the prosthodontist, the periodontist, the endodontist. The endodontist is the one who does the root canals. So you want your tooth, but the tooth is dead, like a cavity came in and the tooth is dead, but the tooth structure is still there. So then they will take out the nerve of the tooth and put in some rubber pits. And so now you actually have your tooth is functional and it's there. And then on top of that, they usually put a crown. So that's the endodontist. And finally, the oral and maxillofacial surgeon. So those ones, all those were 2-3 years. Well, the oral maxillofacial surgeon can do a 3-year or a 6-year. So those ones do a lot. For instance, gunshot wounds to the face, plastic surgery, jaw breaks, the whole idea of reconstruction and put yourself together because of oral surgery. So they are the ones who actually take out wisdom teeth when kids are older, and they do the most severe oral surgery, because we all are trained to do some oral surgery. I do a lot of oral surgery, but when it comes to complicated teeth that are growing differently, or the oral surgeon works with all our specialties. But that takes a little more training than all the others do.
Wow. So those many years you have to pay quite a little bit to go through dental school and specialize.
That is true.
Wow. Very good. We're happy to have you in the community giving us some advice. Why are, of course, I think you touched on it a little bit. Why are healthy gums crucial, and what are some of the signs of gum disease?
Yes, so healthy gums, just like healthy teeth. Healthy gums, the healthier your gums, the prognosis for your teeth is so positive. So in other words, someone who's not looking after their gums may actually have healthy teeth. But like I said earlier, you could actually lose your teeth because you're not looking after your gums. So that is something of concern. So for instance, you will find that in our traditions, because toothbrushing was not emphasized, so it's not uncommon to find a grandmother somewhere in the village with no teeth at all. And yet when you think about it, you'd almost think that each tooth fell out because the tooth was unhealthy. But that is not true. Healthy teeth just fall out of the mouth because the gum disease became so excessive that the gums went down, the bone was exposed, the bone went down, and now the teeth are just hanging. And that's why gum health is extremely important. The other thing about gum disease, many times as I said, it's a window to the body. Sometimes gum disease comes because of other issues you have, systemic issues in your body. So you can find that during pregnancy, women tend to have what we call pregnancy gingivitis. So it's really important for them to focus on really good brushing during pregnancy, because it's a temporary situation, because after pregnancy it's resolved, but the issue is that it really is very painful to have the gums swelling in certain areas. So the issue there is, again, that's part of gum disease. Some of the conditions are temporary, some of them are only salvageable by a good cleaning. And so sometimes you go to a dentist and they say, you need deep cleaning. What actually they mean is they can't do everything at once because your situation is a bit more severe. So then you'll come and they'll do one half and do it, or one quarter, then you come back for the other quarter. And all this obviously is very expensive. So the investment should be at the beginning of life, in being a good brusher, because that is definitely an issue. So the main thing is back to the teeth again, brushing, flossing, doing the mouthwash on a regular basis. You avoid a lot of problems with gum disease.
Thank you very much. And we have another question here related to kids, and I know you said you have that pediatric specialization there. What advice do you have for parents to ensure their kids develop strong cavity-free teeth? And I'm sure you kind of touched a little bit on that. Yeah.
So the issue is to know your child cannot brush their own teeth until maybe 6 or so, and even then needs supervision. So don't neglect helping your child brush their teeth. And of the 2 brushings, the night one is most important. The fluoride rinse is good, but don't let them drink it. So the main thing is to rinse and spit if they can. If they can't, brush it on. Even when they're very young and you don't want to brush their teeth, you can just get a Q-tip, a cotton Q-tip, and then dip it in water and rub the teeth, because the essence is their cavities are going to normally be on the top 4 front teeth, because the bottom 4 front teeth, they're always drooling. So there's a bit of dilution there. But you just get a Q-tip rub it on those teeth before they go to bed. After the last feeding, as they are going to bed, just get a Q-tip, dip in water, rub it on those teeth, because we get a lot of tooth decay from the front 4 teeth before the other teeth have come in the mouth. So I see a lot of children, 18 months old, 2 years old, with a lot of decay, and we call it baby bottle tooth decay. So some of the issues are moms like to sleep with their children at night, and so the child basically does a self-serve. So, it's not like they're going to ask you for a drink. They just open the breast and feed themselves, and mom is sleeping. So they are basically having milk all through the night, which is so dangerous. The other thing is that mothers want to give their children their milk, and so they feel like maybe my child is small, I need to keep feeding the child. So then they're a kind of child who snacks all the time. Or at bedtime, they give the child the bottle and the child sleeps with the bottle in the mouth. So really what it is you have to give that last feeding, then clean the teeth, then have the child asleep. So that is extremely important for children's health. I could probably go on, but the one thing is for sure is the AAPD, which is the American Academy of Pediatric Dentists, recommends that the first visit to the dentist is by 1 year of age or 6 months after the first tooth has come in. So basically what it is it's not so much for brushing, but it's to give the parent tools by which he or she can maintain a good oral health. So that first visit is important. The child could scream the whole visit. That's not a problem. We just want to see what's going on in there and give the parent tips. So if your child is a year old and hasn't been to the dentist, it would be good to call your dentist and figure out if they have a pediatric dentist that they could go to, or if your general dentist is comfortable with seeing little children, that is good too. So that is an intervention, because if you see this earlier you do it, the better for familiarity purposes.
So don't be like me, because the first time I went to a dentist was I think I was 22 or 23. Take the doctor's word here. We appreciate you. One more question about kids here. Let's switch over to the adults. How can older adults maintain strong teeth and healthy gums if they already have chronic conditions?
That's right. So, in the same way as children, it's the same with older adults. Frequent visits to the dentist. If you have chronic conditions of the gum, then you might be more frequent. So 3 to 4 months as opposed to 6 months. If you're missing a whole lot of teeth and you have dentures, then you, like I said, there are some advancements in that area to make it more comfortable. But those frequent visits will help you have a comfortable situation where you have teeth that you can be proud of. Either with implants or the traditional dentures, but seeing someone regularly helps because we end up moving around without some teeth, and then when you don't have teeth, your bite is off a little bit, and so what happens is the teeth drift into the space where there was supposed to be a tooth. So sometimes your bite can be off. Another consideration is there are adults who grind at night, so they grind really hard at night and they wake up with headaches. And that's another dental situation where if you go to the dentist, they'll make you a hard plate, customized hard plate that you can put on the top of your teeth at night, which then when you try to grind, it takes the pressure off of your back molars and you end up grinding with your canine. The canine happens to be the longest tooth in the mouth and can take a lot of punishment. So that way, your muscles of the jaw are not activated because you are not hitting with your molars. So in the morning, you feel real good, like you don't have the headaches anymore, you don't have the pain in your muscles from grinding. So those are issues of adults, the grinding, the missing teeth. But again, having a good relationship with your dentist helps. And so we can actually say maintenance is the biggest deal, but also touch a little bit on the issue of anxiety before I think it was somewhere up here. Yes.
Yeah, that's why a lot of people fear to go to the doctor and they don't.
So the thing about anxiety is that we now have a immediate satisfaction generation. They want everything real fast. So the issue is that now they get to this block where they feel they can't go past this. So they choose to ignore. So you find someone who, not because of their history, but because of anxiety, sometimes it's because of what they experienced before. Mm-hmm. And so they're totally phobic about going to the dentist. There are some dentists out there who specialize in this, who are able to calm the patient down. We have issues of dentists like me who have privileges in the hospital. So then you can take a patient, or you can have an anesthesiologist come into the practice, and that patient goes to sleep and you get the work done. So that is expensive, but it's there as an option for adults. I usually take the low-income kids to the operating room, and that's covered by public assistance many times.
The anesthesia.
The anesthesia, because that is a very costly venture also. But in a way, that way you're avoiding the anxiety. So when I see a child maybe at 4 or 5 with a lot of work that needs to be done, I'll take the operating room, get all the work done, then begin to see the child every 6 months. And eventually that child will be the happiest dental patient and then graduate to the adult dentist with no problems. So anxiety can be dealt with in children. Anxiety can be dealt with in patients. Some patients actually self-medicate before they come, so that either the doctor will prescribe something small like Ambien or Valium before the dental appointment. So there's dealings with anxiety and teeth. People have this relationship with teeth that it means pain. So they think a dentist is always inflicting pain. But those are issues of adulthood also, not only children. So that's the thing. Mm-hmm.
All right, we are almost getting to the end here, and we still have just a few more comments here, and we thank you again, Dr. Musherure. That's been quite a mouthful of things we can talk about. What one piece of advice would you actually give to someone to help them to take good care of their teeth and gums and everything related?
That's right. So basically, like what we said at the beginning, it comes down to frequency. The word frequency. So frequency, if you're someone who frequently snacks, you're in trouble. If you're someone who is regular with your dentist appointment, you're doing well. If you're frequent with how you brush your teeth, morning and night, with the emphasis on the night, you're doing well. So basically what it comes to is look after your teeth. When you're an adult, you don't have replacement teeth. That's it. Have a good relationship with the dentist. In other words, at least once a year, go and get a checkup. And even when there's no problem at all. Our problem, especially in our cultures, is we wait for pain, we go look for the doctor. We should actually go before and have a regular relationship with the doctor. Just like we have, many of our companies force us to do a physical every year for our medical health. In the same way, we should have at least once a year go to the dentist. And insurance, many of us have insurance.
Oh, great. That was the next one. Thank you.
So many of us have insurance, and we have insurance through work. We never use it. That's a problem. You don't even go for the preventive part of it, because there's the preventive part and then the curative part. The preventive might come even with medical. If you look at your policy, it might have it covers a visit every year, and we don't use it. So we should use the insurance. Those without insurance, that's where the problem lies. We do have some clinics in town that do a sliding scale. One of them I heard is closing, but there's called Hope Dental. Hope Dental Clinic in St. Paul. There's another one, North Point. That's in the Phillips neighborhood area in Minneapolis. That the Cook Clinic, which is part of the University of Minnesota. Different clinics that say just come in. If you have an emergency, at least you know they'll take care of it without looking at the bottom line in terms of money. You know, so those are the issues that for people. Some people have set their time apart as non-profits to set up these clinics, which are run on non-profit money and donations to help out those who don't have insurance. So that when you really don't have anything, that's where you go. And I mean, I guess, John, I can give you those contacts.
Really good to know that you can find those other dentists or facilities that can provide you financial support to help you go to the dentist, even if you do not have the resources or you do not have the insurance to pay for the bill. Usually, those bills can be quite high.
Oh, yes.
So, if you're listening, they have mentioned those facilities, dentists that can help provide financial support. And finally, Dr. Musherure, how can people connect with you or your practice if they want more information? I know we said a lot here in the last 1 hour, which is a lot of time you have given to us. But if people need more information, how can they get a hold of you?
Well, within our community, I'm accessible through WhatsApp. If you have a question or you need a connection or something. Like I said, I don't see adults. I'm happy not to see adults. I only see children. But I'm just saying that I do obviously have more resources or at least connections to more resources for both adults and children. I'm more than willing to answer questions if you connect through WhatsApp.
We can't thank you enough. That's quite a lot of information you have provided, and I hope our listeners were paying a lot of attention. In my vernacular, we have a thing or two. We have a saying that says that bwe baba babuulirira omwana wa bobo nga naawe omunako amatu otega kati nno nange babadde bababuulirira awo nga nange amatu nteze. So yeah, thank you very much. We appreciate you. So we will continue to do this kind of programs. Dr. Musherure is one of those pioneers of this kind of talk. We want to be able to help our community, our youth, to be able not to run into problems related to dental health, related to personal health. We will be bringing you different guests to help us learn more on different topics. So thank you for listening in, and we will be in touch. We will be back very soon. And once again, we have here Dr. Musherure, a final word to our listeners and to say goodbye.
Oh, well, it's been a pleasure to be here with our senior manager here. John Mutiaba is our senior man in our community.
Tuwaye host.
So it has been good, and I am grateful to be given the opportunity to share some information in what I love to do. So as we say in children's dentistry, it's a calling. It's not a job. Mm-hmm. So that's why we can do all these years doing something like this. Wishing the community the best, especially during these difficult times that we're going through. And we'll see where everything heads. And being a Mlokole, I'll tell you that I would pray blessings upon all of you.
Thank you.
All right.
God bless you too. And thank you, our listeners. Goodbye. Tune in again. We will please visit our website there. It's www.tuwayeradio.com or media.tuwayeradio.com.